Adjustment disorders. Let's review the general principles of adjustment disorder. If you look at the definition of adjustment disorder, it's nothing more than a maladaptive reaction to an identifiable psychosocial stressor. So the hallmark of adjustment disorders is that a stressor must be present. I don't want you to imagine the stressor. I don't want you to assume there's a stressor. The stressor has to be there in every single question that you look for where adjustment disorder is the answer. Whether it be arguing with your boyfriend, whether it be a divorce, whether it be being involved in a motor vehicle accident, it doesn't matter what it is, but the stressor must be there. Usually, the stressor is what's going to cause the symptoms to occur. Whether or not you develop symptoms will depend on how you cope with certain stressors. Every single one of us has the ability to cope. For some individuals, stressors will affect us in one way versus another. So therefore, that is what will determine whether or not you develop an adjustment disorder. It's very common to have adjustment disorders, and you see it at all genders, in all ages, etc. The onset of the symptoms usually must occur within 3 months of the stressor, and that is important. So if you got fired in January and you start complaining of depressed mood in September, that does not qualify for an adjustment disorder. Why? Because at least 8 to 9 months have gone by. So the depressed mood must occur within 3 months of you getting fired. Once you develop the symptoms, these symptoms cannot last more than 6 months. Of course, these symptoms can become chronic, but for the diagnosis of adjustment disorder, it has to be no more than 6 months. And another issue that's very important is that the symptoms cannot meet criteria for any other disorder. So if you meet criteria for post-traumatic stress disorder, or if you meet criteria for major depression, even though it follows that 3-month and 6-month period, call it major depression or PTSD and not call it an adjustment disorder. Now, typically when people complain of adjustment disorders, the main symptoms that they're going to experience could be anything from anxiety, depression, or any kind of emotional turmoil associated with the specific stressor. Because of these stressors, that will affect your level of functioning to some degree. The treatment will always be, of course, try to remove you from the stressor. Supportive psychotherapy is the treatment of choice. But what if supportive psychotherapy is not enough? Then you have to treat accordingly. If the patient has depressive symptoms, give them antidepressants. If the patient has anxiety symptoms, then of course, give them anti-anxiety medications. The main differential diagnosis for adjustment disorder is just a person reacting normally to stress or any other kind of disorders that could occur following a stress. Let's review 3 examples here. Number 1, a 22-year-old woman was fired 2 months ago from her job. Since then, she's complained of decreased sleep and weight loss. The first thing we want to do is make sure that there's a stressor, and there is. She was fired, so that is okay. We also want to see when the first symptoms occurred. They occurred 2 months ago, so that meets the 3-month criteria. They don't last more than 6 months, and decreased sleep and weight loss do not meet criteria for anything else. So number 1 would be an adjustment disorder. Number 2, a 65-year-old man retired 3 months ago and for the last 5 weeks has complained of depressed mood, helplessness, hopelessness, anhedonia, decreased sleep, feelings of guilt, and a 25-pound weight loss. So, following the same guidelines, number 1, look for the stressor. The fact that he's retired is his stressor, so that's okay. Number 2, let's look at the criteria. Have the symptoms occurred within 3 months? And yes, they have. He retired 3 months ago, but for the last 5 weeks, he's been complaining of these symptoms. So it does fall in that 3-month category. Number 3, do the symptoms last more than 6 months? No. So that would also be appropriate for adjustment disorder. And let's look at the very last thing. Do these symptoms meet criteria for anything else? He has depressed mood, helplessness, hopelessness, anhedonia, decreased sleep, feelings of guilt, and a 25-pound weight loss. Those symptoms meet criteria for major depression. So because they meet criteria for major depression, number 2 is major depression and not an adjustment disorder. Why? You would give him antidepressant. These symptoms are severe, so we have to treat it as a depression and not an adjustment disorder. And number 3, a 40-year-old woman has complained of increased anxiety for the last 2 months. So let's review it in the same fashion. Number 1, the time frame for the presentation of the symptoms is within 3 months, so that's okay. Number 2, the symptoms are not lasting more than 6 months, so that's okay. Number 3, the symptoms of anxiety do not meet criteria for anything else, so that's okay. But what's missing in number 3? There is no stressor. So because number 3 has no stressor, number 3 is not an adjustment disorder. Now let's review the case. A 28-year-old woman without previous behavioral problems becomes angry and bitter after her husband of 5 years leaves her to live with his female business partner. 1 week later, the woman quits her job without giving notice and begins drinking heavily. For the next several weeks, the woman telephones friends and tearfully expresses suicidal rumination. She also makes several threatening calls to her husband's new girlfriend. Is this an adjustment disorder? Is this alcohol-induced mood disorder? Is this bipolar 1, bipolar 2, or borderline personality disorder? If you review the case again, I'm sure that a lot of you would want to put down borderline personality disorder. Why? Because of the suicidal ruminations, because of the substance abuse. But what is important about borderline personality disorders? You're not all of a sudden at the age of 28 going to become borderline. If you look at the beginning of the case, what does it say? She doesn't have any problems until her husband leaves her, and that's very unlikely for a borderline. Borderline personality disorder, your traits start much earlier, so it's very unlikely that all of a sudden she will be borderline. There's not enough criteria here for mania or even hypomania, so when we look back to the choices, we know that bipolar is not an answer, neither is alcohol-induced mood disorder. So the answer here is A, adjustment disorder.